You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, coronavirus continues to explode all across the country. We have about 10.5 million cases nationwide. Texas alone has 1.2 million cases. California, 995,000 cases. The Trump administration really doing nothing. We're seeing, of course, new restrictions in New York City, in Chicago, and you name it. It is unbelievable. We're seeing record hospitalizations as well, surpassed 1 million now new confirmed cases in just the first 10 days of November. This new wave appears to be bigger than the spring and summer surges. And with the holidays approaching, medical experts are concerned that we haven't seen the worst of it. Joining us now is Dr. Karissa Culbreath, Medical Director for Infectious Disease Diagnostics at Tricore Reference Laboratories in Albuquerque, New Mexico. Dr. Culbreath, glad to have you on the show. This is Dr. Fauci and others kept warning us that this was going to happen, that we were going to see another explosion of cases take place in fall, winter of 2020, and we're here.
We are here. We are here. And I think a lot of this has to do with the fact that we did not have all of the early preparedness things in place that were recommended. Mask mandates had been recommended, and some states proceeded with those. Other states did not. And without really having a great consolidated national message around how we can prevent the virus, we end up here where the science and medicine had predicted we would be had we not taken all of these other things into account. So now we are approaching a fall and a winter season that is going to be devastating if we don't start to put intensive measures in place right now. We can't wait, and those measures have to be in place with wide use of masking, having really good social distancing practices. This is really on each and every one of us to take on our own personal responsibility in the absence of great leadership from the highest levels.
And so, and obviously, we heard the news about the vaccine, but just on Tuesday, the CDC came out and said, "My God, wear masks to protect yourself and protect others." But I'll be honest with you, Doc, it's the most unbelievable, crazy thing. When I was in Detroit, we were covering interviewing Senator Gary Peters there. It was a Halloween I think the next night or something along those lines. And, there was this place there, there was some restaurant club. I mean, it was jam packed. I'm talking about virtually no mask on. These folks were on top of one another. It was as if there's nothing happening in the world. Yo, we good. We just going. And hell, the White House, the 14th aide of Trump, Corey Lewandowski, he now has it. Other folks have it. They were passing that thing around at the White House on election night like it was a blunt.
Listen, we are tired of coronavirus, but coronavirus is not tired of us. And people want to take a day off. So they want to take a day off from wearing a mask. They want to take a day off for social distancing, whether it was Halloween, a celebration, watch party, or your birthday. Coronavirus is not taking a day off, and I think that's what we have to be reminded of. There's no timeout for a pandemic. And so every single second of every single day, we have to imagine that the people that we are in contact with may have the virus. I saw somebody ask the question, if you knew somebody in the room that you were in, if you knew they had coronavirus, how would you behave? And that's how we have to walk into every single room, because it's going to impact us. It's going to impact our family. I was looking at some data today from the CDC, and it was absolutely devastating to see that the highest numbers of cases and deaths in the ages between 18 and 49 were in African Americans and Latinos. The highest numbers of cases and deaths in the ages 18 all the way up to 49 in African Americans and Latinos. we have to take care of ourselves. We have to take care of our communities, especially as we're entering into these colder months and into our holiday seasons. Things will look differently, but they'll look different this year so that we can get back to a better sense of normal next year. But coronavirus isn't taking a break.
So, Doc, a perfect example. So we've got 2 weeks from today. 2 weeks from today is Thanksgiving, okay? And folks are making decisions. Would you tell families, black people listening, look, my nephew Chris is 13 years old today. My brother Reginald is 53 years old tomorrow. My birthday is Saturday. I'm 52 on Saturday. My mom's birthday is November 30th. We've got a very large family. But what is your advice to families who are saying, man, I don't care about all of this. We haven't seen each other. We haven't gotten together. We're going to get together for Thanksgiving, have parties or whatever. What would you say to them?
Listen, this is going to be the hardest decisions that anybody has had to make. Everybody has a similar story, right? I haven't seen my sister in months since earlier this year. I think was the last time I saw her. We are all going to have to make hard decisions. And if we could trust that everybody would put their masks on and everybody would have a quiet Thanksgiving, maybe we wouldn't have as much trouble. But we know that once we start to get together, those dominoes are going to come out, the spades are going to come out, we're going to start to get loud, the football game will be on. It's going to put us in risky situations. And the decisions we make for this Thanksgiving will ensure that we'll be with our families for next Thanksgiving. The gatherings will have to be smaller than they have been before, but we've got to find ways to make them work. If you want to see your family next year, you might have to make some sacrifices this year.
So what you're saying is, unless you have a big ass house where you can have real social distancing, don't be having to get-togethers.
We can't have everybody. It's not going to be the same year, and really, honestly, unless some places, if you're someplace that gets cold, that may not work either. Outdoors is always best. If people are going to be together, the reality is the households are going to have to celebrate within households. Maybe smaller, much smaller gatherings than we're used to, but it's about preserving our families and preserving our elders. Though they're the ones that are at the highest risk. We know we have many more stories that we need to hear and recipes that we need to learn from our elders. We need to make sure that we take care of them this Thanksgiving, so we can see them also next Thanksgiving.
Okay, so I got another idea, and I'm gonna take a question from each one of our panelists here. So, okay, how about this here? All right, I'm just sort of throwing something out there. So, what if there's a family gathering, and you require everybody to do COVID testing? Let's just say that. Let's just say, okay, and let's say everybody comes back negative. All right. Can you still have a family gathering? But again, you're controlling can't nobody else come. So it's just your family. Because I'm serious. There's some people out there who are trying to do that, who are thinking about trying to do these events. I'm just trying to give people some understanding of what they need to be thinking about before they just run out there and do something. And so, under what conditions, you're not telling them to do this, but under what would you advise if they are hell-bent on getting together? What is your advice for them on how to make that safe?
Listen, there's nothing that I can say that would make it a 100% safe.
Right, not 100% safe, right? But just safe. I ain't say foolproof.
I'm not saying, but I'm saying.
I ain't say there's some giant condom you gonna wrap on top of the house and nothing getting into. Hell, a condom ain't 100% proof. But the bottom line is, again, if there are people out there who are saying, man, our family getting together, what would you tell them they should be doing to take precautions?
So if people are intent and they're going to do it regardless, listen, you would have to self-quarantine, self-isolate for at least, so starting today, we've got 2 weeks, right? So starting today, you would have to isolate yourself from others, right? And self-isolate, you make your last grocery store run for 2 weeks, you get everything that you need.
For 2 weeks?
You're at least 10 days. get yourself together because you need to self isolate. You would need to quarantine so that you make sure that you don't have any added exposures. But really, there's no safeguard. Some people may say they want to go out and do a test. The test will only tell you what your status is the day of that test. So look, let's take it back to the
So
concept.
that means if I fly in, that there goes your quarantine.
I'm sorry, say it again.
That means that so if I started quarantining today, but hell, if I'm flying back home, there goes my quarantine.
It's gone. Quarantine is gone. Right? You get on the airplane, you're getting exposed. Listen, if you take a test, even if you were to take a test today and it was negative today, that only tells you about your status today, right now. If you go out into public tomorrow, that can change your status. This is rough, and this is hard for me. This is hard for everybody. I wish we were in a different position, and we could have been in a different position, but we're not. And so now the risks are very, very high for our entire community. We're talking about people dying. We're talking about higher death rates in rural communities. We know that many of us have moved out into more suburban areas. And what we're seeing is that if we were to go back into our rural communities and kind of go back to where the family is, we're seeing higher cases and higher death rates right now in rural areas. These are areas that don't have enough hospitals. They don't have enough doctors. So we would be putting added stress on the system if we're introducing more potential exposures, more potential contacts. These are tough times. And there's measures that could have been taken before. Unfortunately, they were not taken. So anybody who has a large family gathering, there is a risk that you are taking on, and you need to think about whether or not that risk is really worth it.
Questions? Erica, you first.
Yes, thank you so much, Dr. Culbreth, for your work and everything that you are doing. Just looking at the COVID tracker project through the Atlantic, and it looks like 1 in 378 Americans have COVID right now. What are you looking at, though? What do those numbers look like probably after Thanksgiving, particularly if the CDC guidelines are people should not gather more than 6 people if people are going to do any type of gathering for Thanksgiving? Just kind of looking ahead with people that probably won't go by those guidelines and that will gather, just to kind of put it in context so people can really sit with those numbers.
Right. Those numbers, if we continue to gather, those numbers will only go up. And what that means is as the cases go up, the hospitalizations go up and the deaths go up. And those are things that we can't afford. And like I mentioned, I need people to understand this is not just something that only the elderly are dealing with. Within our communities, we have the highest death rate from the ages 18 to 49. So that means your college students, your young parents, all of these people in our communities are dying at higher rates than their white counterparts. So the numbers will only go up. We'll start to see positivity rates go up. It's not a factor of testing. If we tested more people and the numbers were the same, then the positivity rate would go down. It's basic math. As more people become infected, we have to test more people. And so it will be very dire for the country, but for our community specifically, if we don't take precautions this holiday season.
Reese?
Hi, Dr. Culbreth. My question for you is, I've seen a lot of new developments. It seems like we don't keep up in terms of what's mainstream knowledge about what things that we find out about COVID. I'm now seeing that I've seen different reporting that people should be wearing surgical masks and not cloth masks. I've also seen reporting that people should not be wearing the masks that have the little vent in them. I've also seen reporting that face shields without masks are not as effective. Can you just give us a recommendation in terms of order of minimum to maximum protection that you think is available out there? For instance, surgical mask versus surgical mask and a shield. I would just like some clarification on that.
Sure, absolutely. I think that's a great question because the information has been evolving. And so, one of the challenges with this is the virus is brand new. So we're all learning together. Surgical mask or a mask with at least 3 layers of protection in it is the most appropriate. Many of us with the cloth mask, there is a place where you can put a filter. There's a little pocket in the cloth mask. I bet most people have not put a filter in that little pocket. So if you have a cloth mask and there's a little pocket in there, the intent is that you put a filter in there, and that will help to filter out some of the viral particles. So a surgical mask or a cloth mask with at least 3 layers would be best. You are correct that the face shield, if it's used without a mask, it really does not have as much benefit. It doesn't have as much value. If you're using the face shield, that's really just protecting your eyes and that kind of mucosal layer around your eyes from being a potential source of being infected. If you are traveling, if you're flying, if you're going to be out in public, you can add a face shield, but a face shield should not be a replacement. There's not a whole lot of very good solid data about the risk or benefit of those masks that have the vents, just because there's different formulations. I think we have to go back to if it's a cloth mask, it needs to be a mask with 3 layers. And then they've also been reporting that the neck gaiters, the ones that go up from your neck by themselves, are not sufficient. The other thing about masks is I've had people ask me about using an N95 mask and using that for traveling or if they're out in public. An N95 mask certainly is the gold standard for mask protection, but an N95 mask is incredibly difficult to wear for a long time. So anybody who has any underlying health problems, any breathing problems, and if you plan to be very active while you are out, wearing an N95 mask just may not be good for you. So you just may not need to do that. And we want to preserve those N95 masks for our healthcare workers. So stick with a surgical mask or a cloth mask with 3 layers of protection. You need to use this mask anytime you are out with people who are not within your family gathering. And also, I know we want to take off our masks to take our pictures, take our selfies. We need to keep our masks on. Any exposure without a mask is a potential exposure. And if you knew the person next to you had coronavirus, would the selfie be worth it? Maybe not. Keep the mask on. There's plenty of cute, nice-looking masks. Wear those when you need to take your photos.
Greg.
Thank you, Roland, and thank you, Dr. Culbreth. I add my thanks as well. We all have fatigue, obviously, quarantine fatigue, and it seems like that your colleagues who were the frontline folk in the hospitals have really begun to affect treatment regimes. And so, where we were in the spring, March, April, May, and where we are now, even as we see this skyrocketing of cases, what's your sense of the potential severity of the cases? Seems like the death rate has gone down some. And is that impacting folks' decisions to perhaps get a little lax fatigue? And I guess that's more than one. Well, I have one final question. I guess this way: would you just tell everybody to stay at home Thanksgiving? Because I'm not going anywhere. I'm just telling you now. But please go.
Well, thank you for that. Yeah, I hope people can hear me say and hear my heart. We all want to be together, and we are all tired. But please stay home. Find a way to stay home. And your family gets on your nerves anyway sometimes. So stay home if you can, and find a good way to do that. But what our hope this whole time has been that there would be therapeutics that would come out that would help with treatment, that would help with therapy, and we are starting to see that. We're starting to see better treatments. Unfortunately, the system was sidebarred a little bit with having to confirm that unproven tests and treatments were not good. So they had to disprove what they already knew with stuff that was unproven but was being touted in the media. But now we are laser focused on finding appropriate treatments that is enabling people to survive. The challenge is until we have something that truly, there's not a cure that's a gold star, like a miracle, it's going to turn around. These are treatments that take time that have to be given in general earlier on in disease. And this disease just ravages the body when it takes hold. And so we are able to allow people and help to support people who are in the hospital and who are ill, but they're still in the hospital for a long time. In addition to that, there are long-term effects that we are now starting to understand after people have recovered. So even after a successful recovery, we are seeing cases where people have extended courses of shortness of breath, extended brain fog where they can't quite get their thoughts together. We are just understanding what these long-term effects are. So even if there's better treatments, I'm hearing people say, well, I can get COVID, but now I'll recover. We still are understanding and learning about these long-term effects. It is not worth it. We've got to stay the course until we have a vaccine that's safe and effective, that's widely distributed, and we can get this virus under control again.
All right. Culbreth, we certainly appreciate it. Thank you so very much for joining us.
Thank you.
All right, folks, back to that Roland Martin Unfiltered video in just one moment. All right, folks, this is the Seat.com virtual reality headset. What happens is you just pop your phone right into here, and then when you close it up, you can actually look at the content on Seat.com, their VR content, or you can look at other 360-degree video that puts you right into the room. So, like, literally, you could just be looking all over. And so, Mary Spio is the founder of the company. She's the innovator behind this, a black woman, sister from Ghana. And so that's their VR headset. They also have these 360-degree 4D headphones. A tremendous bass that covers all across your head. Great sound. Gamers love them. You can attach a headset to this as well. It's Bluetooth. Folks, if you want to get either one of these devices, go to Seek.com, Seek.com. That's Seek.com, Seek.com. Use the promo code RMVIP2020. RMVIP 2020, and check that out. And so we certainly appreciate them being partners with us here at Roland Martin Unfiltered, where we, of course, support black-owned businesses like Seek.com. And also go to their site. You can also subscribe to their monthly content that's right there on Seek.com.